Welcome back. So we're back with the Black Panthers, and this time we're seeing their brilliance in the People's Medical Care Center. And this piece is written by Lincoln Webster Sheffield, and it's in the Black Panther Speaks. Reading. In the current drive to exterminate the Black Panther Party, scant attention has been focused by the establishment press on the Panther programs aimed at serving the people. One of these programs in Chicago is the People's Medical Care Center, located in Lawndale Ghetto on the west side. The center is named Spurgeon, quote, Jake Winters, a martyred Panther killed by police last year. The only publicity the center has received came when city authorities attempted to close it a few days after it opened in December, charging numerous building and Board of Health violations. But the center has remained open in spite of this harassment, and it regularly treats more than 100 patients every week. One of the center's volunteers is Mrs. Sylvia Woods, a licensed practical nurse. We have 10 doctors, 12 nurses, and 2 registered technicians who officially serve in the free medical center, Mrs. Woods told me. We also have a large number of interns who come and help regularly from medical schools around the city. Part of the center's work includes training community people to perform services wherever possible. For example, said Mrs. Woods, we are training some of the young people to do laboratory urine analysis and blood tests, and teams of people from the community are organized to canvass the neighborhood and bring the center to the people. Most of the people in Lawndale are so poor they never go to a doctor until they're practically dying. Our team take their blood pressure, medical history, and in general determine if there are people suffering from illness. If illness is discovered, whether chronic or just simple ailments, the person is urged to visit the center, where an examination, treatment, and prescriptions are all free. In a typical evening of duty, Mrs. Woods may help to treat 20 or 30 people, some of whom come in after being referred by the survey teams, and many who come after hearing from friends and neighbors about the center. The center opens at 6 o'clock every evening, she said, describing a typical night's work. Last night when I got to the center, there weren't any patients in yet. So I worked with some Panthers straightening and cleaning up the reception area. At about 6:20, our first patients arrived. There were 2 children, 14 and 12 years old, who needed a routine health examination for school. When I worked for the Jocelyn Clinic in Maywood, these examinations cost at least $10. But at the Panthers Center, they're absolutely free. If the parents happen to be on welfare, I don't know what they did before we had the center, because welfare wouldn't pay for school examinations. I took the history of the 2 youths, and we did a complete urine analysis and a blood test. Then each was examined thoroughly by a licensed pediatrician. Neither had DPT, a kind of shot. Vaccines, yes, so they were administered. Both patients were in generally good health, except that the oldest had a cold. He was given medication, and we made an appointment for him to return. There was, of course, no charge for any of this. Next, a 21-year-old came in. She was seriously ill, aborting her first pregnancy. She was examined, given some medication for pain, and taken to a hospital that has agreed to take some of our patients. Next, we had several more young people who came in for routine examinations. Then a mother brought in a 4-month-old baby who had a bad cold. The baby was examined by the pediatrician, and a throat culture was taken. The baby had been going to the well clinic operated by the Board of Health, but had not yet received any of the normal shots. After the examination and discussion with the mother, an appointment was made for the baby to return for continued treatment and the shots. So they're catching the deficits in the systems. Among others who came in that evening, Mrs. Wood said, was a young woman who had contracted venereal diseases, several other children, and a woman suffering from a cold for 3 months. All these people were treated free, no questions asked about ability to pay or anything. On hand to take care of all these people were a pediatrician, a general practitioner, 2 interns, and 2 nurses. So qualified staff. The center does not stop at treating medical problems. A member of the Black Panther Party is on hand at all times to serve as the people's advocate. He interviews each patient. The People's Advocate makes the center more able to deal with the entire range of people's problems, Mrs. Wood said. After being examined, the patient and his or her parents, if a minor, discusses any other problems they have with the representatives of the Panthers. The People's Advocate will try to find out if the patient has any difficulties at home, such as paying the rent, finding clothes for the family, food, or whether they may be having trouble studying or in school. Almost any kind of problem is relevant. Whenever possible, the Panthers will help with the problem no matter what it is. For example, we discovered that many of the school children, aside from problems like going without breakfast, face serious strain from the difficulty of finding a place to study or play safe from the hazards of the street. So we opened up the center to them during the afternoons, before the regular hours, where they can play quietly or study, paint, or do whatever they wished. Most diseases the center has treated, frequently discovered by the canvas teams and previously unknown to the patients, are bronchial ailments, heart disease, diabetes, apparent mental retardation, and high blood pressure. The success of the Spurgeon Jakes Winters People's Medical Care Center has inspired several efforts by other organizations, particularly those in the Rainbow Coalition with the Panthers. Both the Young Lords and the Young Patriots have open centers, although they're not yet operating on a full schedule as the Panthers. And this was written in May 16, 1970. Yeah, so we have the model of people. Here's the problem. We go in, we fix the problem. And this is so amazing and so beautiful, like people just giving their time to the community and helping people with their health, something we're going to need more than ever now. So what do you think about it? Thanks so much for listening.